also have some nausea, vomiting, or even diarrhea. Typically, the symptoms start from second day to 14 days. That is known as incubation period. But most of the symptoms generally begin after 5 days of getting infected. And also, it is very important, as I told you earlier also, some people might not have any symptoms. So they themselves are not aware that they are already infected. So who is at risk at work? So we should know, basically there are three types of persons whom we are thinking of. First categories are those persons who are extremely high risk. So being a healthcare worker, including me, we are the persons who take care of COVID viruses along with the nursing staff and the ground staff. So they come with the highest risk strategy. And same goes for ambulance persons and patient transport employee. So, and also dental worker or ENT surgeons, those persons who are, or even non-medical persons like a beauty parlor attendant. So those with a close contact, they are coming to high risk of getting infected. And there would be some person who would be like low risk or low risk. So those persons who are mostly 6 feet away from the co-workers and only needing brief pass by them a few times a day, those are at low risk or moderate risk. And those persons who work alone without any mixing with the crowd and once or twice only human interaction is there, they come into extreme risk. So I'll be sharing some data also. So this is the Indian data. If you see from January to November 21st, 2020, obviously you see as a country, we have hit around 27th October, so 27th September, and after the cases are falling, but you see there is the little bump in the lower side, signifies that again, maybe we are seeing an upsurge. We'll come to this point later on, why we are seeing a second bump again. So, but overall, if you see, the peak has come, but it's down sloping, but again, we are expected to hit another peak. So that will come to that later on. And if you see as a whole, so India is second place, and these are the case loads on daily basis, cumulative 7-day average. So US still is leading us, but India is on the second number still. So right now, 43,000 average cases are happening in India daily basis on an average 7-day average I'm telling you about. So, and also you see the incidence is also mirroring in the deaths, what we are seeing overall India. So if you see, again, the peak was somewhere around the last week of September, but again, you see the second bump, which is coming up here, which is showing increased death rate in India overall. So if, and it's also to signify that how we are testing also, it's not that we are testing less. If you see the level of testing, except for some ups and downs, the testing has been fairly more than 80,000 on an average. So the picture, why I wanted to put this is to see the larger perspective of India as a country. But obviously, if you see, India is a huge country. So there is a geographical difference. When I'm talking about Delhi, it is not same about Bangalore. So if you see the different metros, so in Bangalore, I have put the first slide if you see. So as compared to other metros, if you see, the Bangalore, we hit a peak around last week of October. And right now it is coming down. The cases are coming down. Slightly the similar picture we see in Mumbai. But if you see the Delhi picture, you see there is a U-shaped curve. So typically now they are seeing third peak in Delhi. So initially it was there in July, then again came down, then again September, then again now November, October, again the peak are coming. So we'll keep this in the back of our mind, why this is happening so, and can it be same thing happening at other places all over country also. So if you see, this slide is to show you regarding how the COVID disease affects a typical person. So if you see, 80% of the persons will have mild disease and they require very basic clinical care, but 15% of them will have severe disease, and these are the persons who might require hospitalization, including admission to ward, and some will become critically ill, like 5% of the persons will become critically ill. But if you see India's population as a whole, 1.3 billion, then 5% is very huge number. We cannot handle that. So that is why it is very important to say that the numbers of persons who get infected at one point of time determines the response to this great pandemic what we are facing. So as I told you, the pyramid over left and the pyramid or the triangle over the left. So initially, mild clinical intervention will help 80% of the population, oxygen therapy for 15%, but some critically ill patient will go on mechanical ventilator, and they are very critically ill. And nowadays, see, COVID is no longer a respiratory virus only. It is one of the kind of the virus which we have not seen earlier also. Typically now, with 1 year of this virus, we know that this virus is not only going to affect your lungs or respiratory system, it affects your brain, nervous system. Many persons will have right now many types of different types of nervous system involvement, including stroke or paralysis. Kidney injuries are very common. Cardiac problem. Even if mild problem, they go and to have like a heart attack in future. And also, this is known as thromboembolism, means clotting in the leg veins and also in the lungs, which is also a deadly disease, which is also very commonly seen in severe cases nowadays. Apart from that, liver involvement, gastrointestinal involvement, endocrine involvement, almost all organs are involved. So this is one of the kind of virus illness in which other organs are also getting involved. And also, it's not that all patients will have these involvement at only during the hospital stay. Even after their discharge, they continue to have these damage. So it's a multi-system disease what we are dealing with right now. So my talk focus would be to how to protect ourselves from this disease. So as a guiding principle, we know these are the basic strategy. Physical distance of 6 feet remains the cornerstone, and also hand washing, as we have been already knowing that at least hand washing, that I want to stress, should be for 20 seconds, not a like just washing just like a formality. So it should be a thorough for 20 seconds, and hand sanitizer should be used also. And also those who are working at the workplace, they should frequently sanitize the work surface and the tools. And cough etiquette, what we say, that always you should cover your mouth and nose when you are coughing or sneezing, and to wear a face mask. I will touch this point in a great detail subsequently. And also one, it's very human tendency to touch our eyes and nose. A research shows that we, in 2 hour time, we touch our eyes, nose unknowingly 32 times. So you know how much we are touching our nose and mouth unknowingly. So that is why it is important not to touch these areas. And also, this is also very important that if you feel you are sick, then you should stay at home and bring to the notice of your employers. So I will come to these points subsequently. So the most important of all those things are face covering, the mask and the respirators. So there is a slight difference when we talk about face covering or mask and respirator. I will just go then some technical things about these. So you see, as per CDC, that the Center of Disease Control, it estimates that 40% of infections come from people with no symptoms. So that is why it's a good practice to cover our nose and mouth for all of us as far as possible. And depending on the job type, as I told you, high risk, moderate risk, low risk, it depends on which type of mouth covering you require. So basically when we talk of mask and respirator, the first one is a homemade cloth type. So the basic aim is to keep the saliva particles from escaping to the air. And it is very easy to get and very simple. You can wash it also. The second thing, it can be bought from market also, but these are only for low risk category. So person who are staying alone or at home or with infrequent contact, they can use this face mask with simple cloth. But those who are going out in a crowd or a place where the risk is moderate, where the interaction is more than twice in a day with a human to human interaction, then you should wear a surgical mask. So that is a 3-ply mask, which is standard surgical mask. And the National Institute of Safety and Hygiene approved N95 respirator, what we tell, is generally reserved for high and extremely high risk job and persons who are in close contact, or there is risk of inhaling droplets already in the air, or those who are caring for COVID patients. So those who are at high risk, they only need to wear this N95 mask, not for all. So if you talk about COVID-19 prevention plan, so these are the 6 pillars of a prevention plan. So every organization as a whole should invest some time and resource on taking care of all these 6 points in a great detail. First is physical distancing. Second is procedure for sick personnel. Then practicing good hygiene. Then cleaning and disinfecting the surfaces, and also personal protective equipment. and communication and training. I will touch upon this point subsequently. So physical distancing, most of the time it means staying 6 feet away from others at all the times. And all the times means all the times. This is very important to know, because what we feel that in a place where the public place, we tend to be away, but in our friend circle, or in suppose in a lunch room or elevators or even a break room, these things get diluted. So that is why we need to have posters around everywhere that 6 feet difference should be maintained. And these are the vulnerable points, like workstation. Somebody has some work with some other person, he will go and just casually ask the person. So then this 6 feet difference is breached already. Lunch rooms, break rooms, elevators, and even in vehicles. So to minimize that physical contact, staggering of workforce, working in shift, work from home, then use of drop boxes to have this decrease the frequent contacts, and also to limit the numbers of person in each workspace, and taking separate vehicles, and avoid touching the surfaces as well as the nozzle, the surface area, and common equipments are to be encouraged. And also I will invest some time in this, because you always, every organization should have daily symptom checker. Even as a like a airline industry, that should be a checklist. So those who have some of these symptoms which I mentioned already, they should either stay at home or they should leave work unless they are cleared by the medical board or the medical person, whoever is the in charge of the organization for the medical side. And it is very important, even if you have a mild symptom, you should not ignore, because even asymptomatic patient can spread. So if a person feels that he's sick, he should contact the designated healthcare provider and discuss taking COVID-19 test without any hesitation. And also you should report this illness to your employee health center, and you should maintain always a close contact with the employee health center. And if you have a case which you suspect, then obviously you should document the symptom, location, close contact tracing, and you should recommend the self-isolation till he is cleared. And also you should notify the contacts like the children going to the school. So those contacts also need to be taken care of. And most important, what I want to highlight is all the endeavors should be to protect the identity of the individual, because COVID now is no longer a medical problem. It has become a social problem, and with so much stigma around, even at a workplace or at your home also. So it is not to bully the patients, or because it's not their fault. So we should protect the identity of the individual who are suspected of having COVID at the workplace. And also, I will spend this slide also. It is also about the human HR department responsibility, because obviously if he has to take away work from home or he has to take a leave, he should not feel the strain of getting a negatively have negative repercussions in future regarding his salary or the leave or something. So the upfront, the organization should offer a written HR plan for the employee, that in case they are suspected, then how they are going to support them. So that, because this will encourage them coming forward and to take the test, and also to stay at home and minimize the risk of further spread among the employee. So practicing good hygiene. So washing hands 20 seconds, avoid touching using hand sanitizer, and hand sanitizer stations should be provided at all places. And the cough etiquettes, what I already spoke about. And also your workplace is the source where it could be frequently contaminated. So those areas which are in common source, biometric areas, regarding the biometric scanning, it's a good suggestion to have a face scanning, as we are doing at Sakra. So we no longer have a fingerprinting or biometrics right now. We also do a face scanning attendance. So this is something which is no touch protocol. So similar thing can be done at all the organization. And cleaning of the surfaces should be a written, like a hotel industry or a airline industry, the checklist should be there of an hourly or 2 hourly contamination of the surfaces. Also, personal protective equipment, those who are in hazardous areas or likelihood of infection spread should cover their face, and depending on their risk profile, respirator they can use. And hallways, stairways, restroom, elevators are the areas where this needs to be done at a higher priority level, because these are the areas where the infection spread is more. And you should always remember that closed face coverings do not replace the job specific PPE. So if you are going to a contact to an area where the spread is high, then face mask with a face shield is desirable. Not only plain simple cloth mask won't show you all the protection. And also, as I told you, the sixth pillar is communication and training. So one time just listening to this type of lecture will not help. So it should be inculcated in your organization on a daily to day basis. And there should be a written plan, and a site specific training is required. And there should be identification of team leaders in each department. Maybe a person should be assigned to daily watch the healthy habits of the contemporaries or the co-workers, and there should be some sort of recognition of these things. And so what we say that always to have a cheerleader in your team, and they should be communicating with the persons and taking care of these things. So communication and training is very important. So now I will spend some time how to decrease the severity of COVID-19, even if somebody feels that he's infected or there is a risk of COVID-19 infection. So obviously, apart from medical things, the non-medical things are also there. So I'll spend some time on that. So attention to wellness and self-care habits are very important. What I mean to say is that you should prioritize your health as number one, because I give example to all my patients that they remember to do servicing of their cars every 6 month basis, but they do not remember to service their body. So that is how we are lazy as a species. So now the time is to give priority to our health. So maintain good hydration, balanced eating, exercise, have a good 7 to 8 hours of good sleep, and stress management. Because these are the well-known things, but less practiced things, because this is something which will give you good health and support your immune system. So if you have 7 to 8 hours of good sleep, it is enough to reboot your immune system rather than popping on some vitamin tablets or something. Second thing, some deep breathing exercises, either from the side or from our yoga or the pranayam, what we say.
My face can be seen.
Yeah. So these things also detoxify your body, and they have a role in your boosting your immunity. Then also, to put it simply, get more fresh air. So with the lockdown and everything, everybody is confined to home only. Obviously, the outdoor exposure is less, especially for adults and kids alike. So that's why we should spend some time exercising outdoors. Aerobic exercises are good, such as brisk walking, jogging. That improves your lung function and also your immunity. And also, if you are staying at home, you keep your window open, because it's not that COVID will enter through your windows or something like that. So that's the amount of circulation of air is very important. So, and also, even if you're home, the areas where you touch, like the light switches, door knobs, these should also be a part of cleaning. So it should be also taken care of to clean these surface decontamination as you are doing at workplace, also at your home. So, and also there is some role of nutrition also. As I told you, balanced diet is very important, but something like, as a general rule of the thumb, any colorful vegetables, red, green, purple, so whatever you want, colorful vegetables and fruits are good source of the vitamins and minerals. So as a guiding principle, the more the better. And vitamin C, D, zinc, magnesium, these things are very important for your immunity. So the foods which are rich in vitamin C, like citrus fruits, oranges, zinc like poultry and non-veg items sometimes, these things are good for consumption to boost your immunity. And also good fats, so like omega-3 fatty acids, chia seeds, flax. So these are good for immunity. And also probiotics. So these are the good bacteria that is there in yogurt. So those things also increase your immunity. So a good time should be spent looking care of how you are eating and what you are eating. So because they have a bearing in your nutrition. Because I will tell you, I don't want to frighten you, but this should always be kept in the mind that this COVID is not a simple disease if you are in trouble. So if you see patients who have cardiovascular disease, diabetes, so those will have higher death rates also for having COVID if they get to hospital. And many times it's not that only these person will get sick or the old age will sick. As a doctor, I see daily, sometimes 19-year-old, 20-year-old, 25-year-old, young person without any comorbidity also become sick. So everybody should be assumed to be at risk until proven otherwise. And the symptoms can worsen rapidly also. Because what is, because in a home, when we are sitting, we are just watching TV, media, this is one side of the affair. But those you ask who have gone to the hospital, they will tell you what happens once the patient goes as a COVID patient to hospital. So most of the hospital stay, including God forbid if you land up in ICU, will be without access to your relatives. So you are there alone fighting the disease on your own. And also we as a healthcare worker will be donning our PPE kits like astronauts. So there might not be a good human to human interaction always. So the psychological counseling and face to face, smiling face is a rarity. So that takes a bite on your psychological mental well-being. We see as a patient who are admitted, very difficult time for them. And also when you are in hospital, back home, your family is also suffering. And there is so much stigma attached. You would have read in many times in the media what happens even after death, during cremation, during burial, they are opposed. So these are the harsh fact of COVID, which is not related to medical practice, but these are something which is very important to keep in the back of the mind, so that at least somebody gets scared and do all the things what I'm telling you about, to be scared to be in hospital. So we do not want to you to come here and face what others are facing. So if you see, just to give how COVID is treated apart from medicines, because medicine for COVID right now, all treatments are experimental. In COVID, there is not a single drug except steroids, which has been approved and proven to be of benefit. So that's why step one, patient admitted, very low oxygen requirement, will go on with a nasal cannula or we give some oxygen. Those who are slightly sick will give something like a CPAP machine, a mask is put, oxygen is given, and then patients who are very sick land up on ventilator or other things. So this is how we treat a COVID patient in hospital. But so if you see the recent trend in India, again coming back to the same, so there is a disparity. As I told you, India is a huge country. So one side, we see that overall the cases are falling down, but there are certain states where the cases are coming up. And Delhi, Haryana, Rajasthan, HP, the cases are coming up. Why? So I will spend some time in that. So this is a very human tendency. This is known as COVID fatigue. So initially March, April, May, when the lockdown was announced, everybody, including the cats and dogs of the houses, were confined to home only. Nobody was coming out of the fear. But unfortunately, when the time is really to be inside, everybody is roaming around. Why? Because people are getting tired. But unfortunately, the virus is the same, if not less. And also, from February, March, April, May, the months have rolled out one by one, but there is no sign. Everybody has now realized that this COVID is here to stay. So there is a anxiety and fear, and the people are feeling already drained. What to do? And also there is a psychological tendency of this behavior, because they are not bothered about the result, because as I told you, everybody is in autopilot mode, because he thinks that I am okay, but he doesn't know what will happen if I get. That part of realization is still not there. And also as the motivation dips, you see the persons are getting more lax about social distancing and other guidelines, because these are very simple: hand washing, putting a face mask. But you will see if you go to the road, 50% of people are poking their nose or out of the mask. Just for the formality, they are covering, or the mask is in the neck. So this is not something which will prevent the virus. So this is a picture I'm showing you from Delhi. So you see, this is a Diwali, just before 1 week of Diwali. And you see, people are there with mask, without mask, half mask. And where is the social distancing? So it was bound to happen. And you see, it's a mixture of, it's not only the persons who are at fault. Obviously, Delhi as a model, I'm saying air pollution. And it has been shown that the COVID virus settles on this PM10, 2.5 microns particles, which is very common in pollution. And then when you inhale, it goes inside, and COVID plus pollution is a deadly combination. So this is also contributing. And also you see how we test also matters. So if you see, this is just the Delhi data I'm showing you here. So there is something known as rapid antigen test. So if you see versus RT-PCR, sometimes in September we lost the track, and we were overdoing antigen test, not doing more of RT-PCR, because antigen test could be 50% false. And also they were relying more on symptomatic patient. Asymptomatic patient were doing less testing. So these things will increase your positivity rate subsequently. So if you see right now, this is the graph to show the other metros combined. So if you see, Delhi is leading on average basis, but other states are also, you see, downward trend is there. But it is predicted that in future, maybe in a month or two, if the same things, what we are saying is going on, then other cities are also not far behind. And if you see the data of Delhi, just as a symbol I'm giving you, the positivity rates, you see, in last October weekly basis, you see, it is increasing proportionately. And only in last 15 days, they have added 1 lakh new cases. And the 10.3% positivity rate is very high rate right now. So Delhi is going upstroke, no doubt about this. So also I will spend one time, because many person feel that if I got a virus for one, am I immune? Whether reinfection will happen or not. So reinfection with the virus is probably rare, but it happens. We have seen here also and abroad also. Because this virus, as I told you, it's a strange virus. It's not like a chickenpox virus where you have one-time infection and for whole life you are immune. The antibodies, what you have, is nobody knows that whether they are protected or not, but probably it is not protective. Even if it is protected, it's only for a very short while. So that is why infection with COVID-19 no ways means that you should be very complacent and you have got a medal to show that I have already been having the infection, so I will not be having. It's not like that. So always, because it shows that you are the person who are more vulnerable. Because at the first place, why you got first time infection, if you do not mend your ways, you will get the second time. And also the second time, what we see clinically is generally harsher or the severe than the first time. So that is why reinfection with COVID is a reality. We should always keep in the back of our mind. And regarding COVID vaccine, because many of us are very optimistic regarding vaccine, what will happen if the vaccine come and when it will come. So this is the chart for all the vaccines, what we are doing, but I will spend more time in other slides regarding than this. So if you see, out of all the candidates, there are few candidates which are leading the front. So like Moderna, Pfizer, Johnson & Johnson, our Bharat vaccine and Oxford. So these are in the phase 3. Some of them are in India also, they are doing the trials. But problem is this. You see, this is the slide which I will spend more time. One thing is that vaccine before only it has come, you see as example of Pfizer vaccine, 80% of Pfizer vaccines has already been reserved for rich countries as of now. They have already placed the order. And they are the 14% of world population. Rest 86% do not have access. So second thing, we all have hearing that first vaccine who will get? Healthcare workers will get, politician will get, or high risk. But we know as a country or we know as a world, when vaccine comes, prioritization of vaccine may be a theory. So whoever is there, who will get, these are the complex question. And also you see there are technical things also. If you take example of India, the population 130 crores. So you forget about vaccine. We need 260 crore syringes for 2 doses. If you want to vaccinate entire population, and if you want to only vaccinate 60 or 70% of the population also, then 200 crore syringes. You ask the companies, they are not in a position to manufacture this 200 crore vaccine. So syringes. So how will you give the vaccine? Second thing, suppose even if you have access, suppose think of a remote village. First you are going to give vaccine to old person, then you are coming back. Again going to the same village to vaccinate the children and pregnant female. Then again you are going to the same village to vaccinate somebody else. So how many times you want to go to a village? 4 times, 5 times as per your priority. And you have to replicate the same for entire India. So, and also these vaccines, Pfizer, Moderna, Pfizer vaccine minus 70 degrees centigrade. You need to store that. How will you maintain the supply chain? Moderna minus 20 degree. So we hope that something like Oxford vaccine or our own country, Bharat vaccine, who require lesser of these stringent cold chain maintenance. If it comes, then only we are lucky. But at the same time, when it will come, you can understand from my slide. So over reliance on vaccine should be a dream right now. Right now, only thing which can help would be the simple things what we told. So I will conclude with this. COVID-19 as a disease is a social, medical, economical, and psychological disruptive disease. Nothing like this we have seen in our entire life, and maybe in subsequent years also we'll not be able to see something like this disruptive. And the new normal is not to fear with COVID, but we have to live with it because it's not a one-time affair. It's like a frequent visitor. Our the guest will keep on coming, so we have to we want to learn how to live with it. And masks, social distancing, sanitization, these are the pillars of prevention. And here I have not put vaccine, you see, because still, as I told you, these are the main things. And COVID-19 is not a one-time disease, 7 to 10 days or viral disease. It's a long-term medical and social implication also. We are seeing many patients who have been cured, but now coming with lung scarring, lung fibrosis. So these are the medical complications and also social implications that persons who are employed, those who are in one place, they have gone to their hometown, how they will get employed, how long they will work from home, how their productivity will go. So these are the social implications. And also pandemic is long drawn. There's just, it's not an abrupt end which is in the sight. And also vaccine as of now when I'm talking to you today still is not a reality. And if it available, there are still numerous challenges exist in the delivery and actual point of care delivery of the vaccine. So thanking you all for your patient hearing. So any questions, then we can take it. And I give Sheetal now, you can take over.
Yeah, thank you, Doctor. First of all, apologies from my side. There was some technical glitch at my system, so it got delayed from our end. And thank you very much for such wonderful thoughts and such great information. I'm sure everyone will take full benefit out of these. Now I request my team members, if you have any queries, please raise it, and doctor will be more than happy to anyone, please unmute yourself and please ask the questions.
Dr. Sir, my name is Ranjit Aluwalia.
Yeah.
Actually, we have one more seminar earlier last month. So we know that once we have become positive and then recovered and become negative now, so there are less chances of getting infected again. But still, can we be carriers also? Or last time we were told that the chances are very less, almost zero, that we become infected. But still, can we become carriers and become a scare for somebody, others people? Means infection can be flowed from our body to their body.
So generally speaking, when we say of a carrier, so basically once you have this viral infection, generally 10 to 14 days only there is an active viral shedding. So basically after 2 weeks, maximum to third week, even if you are positive, it doesn't mean that you will be spreading it to others. So generally as a dictum, a week, 2 week time frame is the time frame when the patient of COVID is highly infectious to others. After that, the viral shedding drops. Even if you have COVID report which is positive after 3 weeks, 4 weeks, then it is just because of the dead bacilli, dead virus, or the antigens of the virus, not because of the infective virus. All the same. That is the first part. But if you test negative, then it's not that you are less probable of getting reinfected again, as I told you. So there is again still a chance that you might get an infection and then you can still spread to others. So these two are two different things. One is the original infection. Second thing, in case you get reinfected, then obviously again the second week time frame comes into the picture and you could be infectious to others during reinfection in case it happens, although it is rare.
Okay, as a layman, I understand that my immunity, my antibodies are built in my body, so I will not be getting infected for sure, but I may still be spreading it to others.
No. So you should, these antibodies are not like other antibodies of the disease. That is what I told you. Because like suppose chicken pox, so those antibodies last for life. So they are protective. But COVID antibodies are not protective as of now. So there is no research to back that. Once you have, even if you measure your antibody level, that those what you are having in your body, whatever be the titer, is it really protective or not? Nobody knows. So in COVID disease, even if you are having COVID disease and you recovered and you have antibodies, this should not be taken as a COVID certificate of immunity. So that is why even if you have antibodies, they are not protective. Even if protective, they would be only for short term. So that is why this is a different type of virus where the antibodies are not protective most of the time.
Okay, thank you.
Dr. Saab,
Doctor?
in continuation to Ranjit San's query, just a few days ago, I had read in a newspaper that people can get infected up to 2 months or so as well, even if the person is recovered from COVID and test negative. How far
Yeah,
this
so
is
that's
true?
fine. So there are two things. One thing is that suppose today somebody has COVID infection and he recovered. So, but he didn't test negative. Continues to be positive at 2 months. So that scenario is more commonly seen, but he is not infective to others, as I told you. The other
Okay.
is that patient is COVID and he recovered, but again he got reinfected. So that is also possible now. As I told you, that is why this single infection does not provide you immunity. So maximum immunity, even if you have, generally is 1 month to 3 months time frame only as of now. But you can get reinfected in any point of time. So that is fairly possible, and we have been seeing the patients also who has recovered within 3 weeks, also 4 weeks, also after testing negative, also they have become again positive with symptoms.
Okay, thank you.
Doctor, this is Anand from Delhi office. In addition to Mr. Ranjit's question, as you said, it depends on person to person. Normally, the virus gets diluted after 14 days and there is less risk of spreading it. Suppose for an infected person, can we take it as a 14 days as a waiting period? Or when normally doctors advise to go for a retest, whether we need to go for a retest to ensure that it is a negative report, because some governments are not insisting on that. What is your suggestion on this?
So there are two types of suggestion. One is for medical and one is for social reason. I will come to that one by one. So medically speaking, those who have mild symptom, mild symptom means only fever, cough, cold, no requirement of oxygen at any point of time. So those persons need not be tested. So even if they are hospital admitted, we do not test at discharge. Just we tell to have home quarantine for 7 days more. So basically from symptom onset to 2 weeks to 17 days is the time frame. We tell them to be home quarantine from the symptom onset. That goes for mild cases. For moderate to severe cases, means those who required oxygen or any other higher than oxygen, means ventilator, then generally before discharge, we test them. So the only testing is required in moderate to severe cases before discharge of the hospital. Mild case or cases who are in home quarantine as a mild or asymptomatic case do not require retesting, medically speaking. But now comes the social picture. Many persons who go like a waiter in a restaurant, a nursing staff working in a hospital, a doctor working in a hospital, or a industry where the risk of transmission is very high. So depending on these social issues, sometimes they require negative test before they rejoin their duties. So these are the social factors dictating repeat testing. But as I told you, for all mild or asymptomatic cases, they need not be required to be tested after a period of total from symptom onset to maximum 17 days. As a dictum, they are because no longer infectious to others.
And for a deep contact person, suppose if he doesn't have his symptoms, then 14 days quarantine is sufficient. Suppose for a symptomatic patient, do we really need to ask that close contact person to take a COVID test to ensure it is whether infected or not? Or you suggest the person having symptoms also to be on quarantine for 14 days?
So any person with symptom should be tested, no doubt.
Okay. Okay.
Suppose person X is in home who has COVID and Y is taking care of him. So as a rule, after 3 to 5 days of exposure, he will he will be getting tested because carriers are also there. So any person who has close contact is defined as more than 15 minutes of exposure within 6 feet of distance. So any person who is less than 6 feet for 15 minutes or more. If it is there, then generally by dictum 3 to 5 days from the last contact, ideally they should get tested once. But there is no need to retest them, as I told you, if they are asymptomatic. But those who are symptomatic any point of time, irrespective of contact or not contact, they need to be getting tested.
Thank you, doctor.
Thank you, doctor. Any other query? Yes, Ms. Ranjula.
Good afternoon, Dr. Sachin.
Yeah, good afternoon.
My question to you is, I heard that the type of COVID wherein a person loses a sense of smell and taste, it is the mildest form of COVID infection, which never impacts the lung. Is it true or is it a myth?
I will tell you, there is certain reality in that, but the medical science is very complex. Disease do not read textbooks. So there is no fixed rule. So, but in general, we say those who have loss of taste sensation and smell sensation, generally speaking, they do not go on to have a severe symptom. Okay, but
Okay.
not have taste and smell doesn't mean that you will not get severe. So it's individual to individual basis, but largely speaking, yes, we have seen that in our experience that those who have loss of taste and smell generally do better. They do not go to have severe disease. But as I told you, exceptions are always there.
Okay. And doctor, what kind of investigation a person should undergo after being COVID negative? Further investigations, medical?
Okay. So generally speaking, it depends again on the what kind of COVID he had. If was after asymptomatic, then no testing is required. But if he happened to be in a hospital for a moderate to severe COVID, then generally speaking, they should consult their primary care provider, because during their stay, some types of blood clotting test we do, D-dimer, ferritin, CRP, and markers for heart and other diseases. So they can be repeated on the first follow-up. But these are reserved for patients who have moderate to severe symptoms and they had a specific problem during their stay in the hospital related to COVID. Otherwise, it's not a customary to do all tests on all the patients always.
Okay, right. Thank you, doctor.
Yeah.
Thank you, doctor. We have Mr. Naveen Sharma who has one question. Naveen san.
Dr. Saab, if someone's spouse is a health worker and coming back home, what precautions the family member should have?
So first of all, you should welcome her. So, so because she is doing a great job, because as a healthcare worker, we feel how it feels when we go to home. It's a kid coming, we do not tell no, don't touch me. So but as you're answering your question, so basically healthcare workers generally are primed during their training also to take utmost precaution for themselves also and for their near also. So I will give you my example. So I come to the hospital, change in scrubs, then I don the mask, protective equipment, go for round, sanitize after each patient. There are key moments. So wherever before and after touching those or performing some function, we need to sanitize. But before leaving the hospital, if I have gone to COVID zone, I take a bath here and here. I change my scrub again. I put a new clothing. Then I go home. Then all the shoes, other things are outside my home. And before the entrance, I again have a sanitizer. And then I straight away head to the washroom to again have a soap and face wash. And then again you change the clothes and then you go to your usual self. So generally speaking, if I tell you that it's not that clothes or the surfaces that my major road of transmission, more is that cough and respiratory particles. If infected, then obviously he will spread. But it is not that being just a healthcare worker, the surface or the hand and feet are contaminated or the clothes are contaminated. So there is no need even to wash it separately. I do not wash my clothes separately. So we wash in the same washing machine as my family. But the most part is that all the surfaces which keeps on touching to others should be sanitized before entry to the home. And as far as possible, again, the mouth nose part is the main spreader. So you should take all the precaution for those parts.
And Dr. Sam, one more thing. Now the winters are approaching and everybody will be wearing the big heavy jackets and all. It is impossible to wash every day.
Yes.
So, what should be the procedure for these cases?
So as per winter, two things should be done. One is that if you're not able to wash, always sanitizer, pocket sanitizer you should keep, because sanitizer is very good thing and it is very effective also. That is one thing. Second thing is that generally speaking, during the winters, you should take care of your those who are like more than 65 years of age, or those who have diabetes, any other like kidney disease, heart disease. They should take flu vaccination. Means I will touch on that. Means influenza flu shots, what we tell, and other vaccines to prevent infection from happening. Third thing, winter clothings. These should also not be like you cannot wash it also daily basis. So you should have either in like 2-3 supplies of the clothing which you should keep on recycling, because the virus has a definite life on surfaces. It cannot be living forever on a surface. So it's a good habit to recycle your jackets. So if you're not able to wash 1, 2, 3, 4 number jackets, second, third day, then take the another one. And then wear after a period of time, should not be continuing with the same jacket for 3 days at one go. So it's a very common thing which we can do to prevent the viral contamination of the surface of your woolen clothing also.
Thank you, doctor.
Thank you, doctor. This is Sudeshna from Marubani Kolkata office. Thank you for your session. It was very informative. I have a question which is not related to workplace at all. As you mentioned, like COVID-related fatigue is there. Yeah, it is a very big thing. Now, like for children, they are also confined to home for almost 8 months. Now is a time when they really want to go out and play. So during that time, should they wear a kind of mask or something like?
I will tell you. So children, the good part of the COVID pandemic is that children are spared to a larger extent, both getting infected and regarding the symptoms. But at the same time, you should take all precaution. So mask during playing, it's a debatable issue, because you see when you are running, swimming, cycling, your oxygen demand of the body goes. So generally speaking, if there is a physical distancing rather than wearing a mask, and if you are doing outdoor sporting, then you can go without mask also as far as possible. Children playing, but physical distancing should be the rule. And also reporting of means the child, mildest or sick child should be encouraged to stay at home rather than mixing and going out to play. So, during the play, if they are maintaining physical distancing in an outdoor environment, then for the time when they are playing, they can take off their mask also. But elder children or like a which requires like a indoor games, something, those things obviously you should take all precaution to wear mask as far as possible.
Thank you so much.
Doctor, this is good afternoon. This is Debashir from Calcutta office.
Yeah.
I want to know two things. One thing is a person affected with COVID. He has been tested COVID and admitted in the hospital, and thereafter he has been treated for 5-6 days. Then he or she become asymptomatic. Then, as per the according to the doctor, as per ICMR, so as he or she has no symptoms, so she is being released without any negative test, and she has been advised to stay in the home for quarantine for 6-7 days and then go and then continue her work. So without any negative test, is it means allowed, or does she becomes negative by automatic, or how can you confirm that she becomes negative? He or
As I
she
told you,
becomes
yeah. As I told you earlier, there is a medical science behind this, because it's not only a logistic issue. So as I told you, the viral shedding is maximum in the first week, and generally after 2 weeks it decreases drastically. So that is why for all practical purpose, all persons who had a mild COVID, asymptomatic COVID, after a period of maybe 2 weeks to 17 days, they are no longer infective to others. So that is why this thing, we need to say that they do not require a repeat COVID negative certificate before they go to home. And obviously precautionary measures, 7 more days are advised by default. So 1 week of symptom, then only you landed in a hospital, 7 days in hospital, and 7 days more quarantine. So it makes 3 weeks already. So generally speaking, 99% or 95, more than 95 to 98% of the persons will not be infective to others by this time. to certain high risk category where they have frequent risk, then those areas only they require to be tested again before going to meet others.
One more question, doctor. In regard to the COVID, since it affects the lungs, so in case you make a chest X-ray of the lungs X-ray, so can you get an idea whether this COVID has affected the lungs? Means basically the lungs fibrosis, which is basically finally COVID affects the lungs and finally leads to the pneumonias and finally leading to the death, you see basically. So can you, at the initial stage, if you make a chest X-ray of the lungs, so you can understand that whether the COVID is affecting the lungs or not, or whether you are getting prone to the lungs infections or something like that?
So you understand that every medical test has a limitation, because this COVID, 80 to 90% or even 95% of the person will have a normal X-ray. This, it is not necessary that you have COVID, that all COVID persons will be having pneumonia on X-ray. X-ray will detect only pneumonia, means if lungs has already been involved. So as a routine, there is no recommendation to do X-ray on all the patient blindly. Those who are symptomatic, means having cough, breathing trouble, or have requirement, so those only require X-ray or even a CT scan, because CT scan is even better than X-ray, but the risk of radiation is there. So generally speaking, for all moderate to severe cases, when they are in the hospital, we do a CT scan, and those cases which in follow-up have some symptoms, then also we do a CT scan and other tests to confirm whether they have lung fibrosis or not. But X-ray alone will not detect, nor it is required, and the lung is not involved in all the cases also. So that is why there is no need to do X-ray on all the patients.
Thank you so much.
Yeah.
Hello, doctor. This is Shobik from Marubeni, Kolkata. Thank you so much for your wonderful presentation. Actually, I had one question. Like, my parents are already senior citizens, so like I was wondering. You mentioned about influenza shots and flu shots. So, do you recommend such kind of shots before? Like, will it mitigate the chances of infection of COVID? Can you kindly enlighten us?
So it is not directly related to COVID. These vaccines are for influenza and pneumococcal infection. But obviously, if you have COVID and have secondary infection with these things, these are deadly. So that is why it's a good idea to prevent non-COVID pneumonia also along with COVID, because ultimately, right now in Delhi, if you have non-pneumonia also, will find difficult to get a bed even. So, forget about the treatment. So that is why it's a good practice. Anyway, it is a formal recommendation from medical side also, that all persons who are more than 65 years of age or those with comorbidity, they require yearly vaccination for influenza and also a pneumococcal pneumonia vaccine every 5 years. That is a protocol to give.
Thank you. Thank you so much, sir.
Yeah.
Thank you very much, Doctor. And thank you all the staff members for joining. I believe Dr. Sachin is getting late for some other appointments. So we will not take longer. Just a few words from our chairman and managing director, Mr. Suzuki, and then we will wind up, sir. Please be with us for a few more minutes.
Yeah,
Suzuki-san,
you can always come back to me anytime.
Thank you very much, sir.
Thank you very much,
staff...
Doctor. Thank you very much, Doctor. We learned a lot of things, and it's very worthwhile to listen to. Thank you again.
Thank you.
Thank you, sir. Thank you, everyone, for joining.
Thank you.
Thank you.
Thank you, Doctor.
Thank you.
Thank you.
Thank you.